Hello and welcome to Homeopathy Simply Explained. I am Petra Merker, a naturopath specializing in classical homeopathy from Darmstadt. In today's seminar, we will talk about nicotinic receptors. I'll give you a brief overview of the topics you can expect today. We'll talk about the comments under the last German video, the broken bridge syndrome, and we'll talk about vascular tone, as this can be disturbed in ME/CFS patients, and then move on to the nicotinic receptors with the homeopathic remedies Bungarus and Tabakum. Question 1 is, isn't there a risk of contraindications when administering so many different remedies? Of course, there are also some homeopathic remedies that, for example, reduce the effectiveness of another homeopathic remedy. However, I don't see any danger in the traditional sense with well-chosen homeopathic remedies. Since I treat in the high potency range, one can determine relatively quickly whether a homeopathic remedy is helping the patient or not. And of course, one has to follow such patients very closely. The problem with ME/CFS patients, and in this case my daughter, is that the symptoms are so severe and we need to find relief for the patient quickly. So we can't just give one global and then wait 8 weeks for the reaction. Of course, at the beginning of the illness, I tried to use a single drug therapy as I had been used to up to that point. However, I quickly reached the limits of this approach. Some areas improved despite a well-chosen homeopathic remedy, but others remained poor. I had never had this experience in my 20 years of homeopathic practice. My former students can testify that I have always treated very strictly according to the rules of classical homeopathy, and I still do so with most of my patients. In the future, I will also present cases in detail in which people have been on their constitutional remedy for over 15 years and are doing very well with it. If you would like to get a little taste of this, you can watch the videos on ulcerative colitis, lichen sclerosus, or chronic pyelonephritis. Unfortunately, this single remedy therapy no longer worked for my daughter's illness. In my practice so far, I have observed that in a patient with one or more one miasm and its symptoms would still be predominant, which then required a homeopathic remedy. If the miasm was successfully treated homeopathically, it faded into the background in a weakened form, and the constitutional complaints came to the fore again and wanted to be treated. At some point, the miasm would reappear until, after a certain treatment interval, it finally disappeared and the patient only needed their constitutional homeopathic remedy. It was like an onion where the other layers gradually peel off through homeopathic treatment until one gets to the core of the constitution. In my daughter's case, I saw a picture I had never seen before. Several layers of the onion, each with its own symptoms, were simultaneously in the foreground. My suspicion is that in complicated post-syndrome patients, the system is so weakened that disorder in the organism is also disturbed, and everything is thrown into disarray. Thus, in my daughter's case, the symptoms of shock, the symptoms of a head injury, the symptoms of hypothermia, and the symptoms of COVID infection were present simultaneously, and all required a homeopathic remedy. I tried treating her with individual remedies for 9 months, and was only able to achieve success when I abandoned my previous ideas about homeopathic treatment and prescribed a remedy for each individual symptom complex. I have not observed any contraindications. On the contrary, our daughter benefits greatly from this approach, which is new to me. Naturally, I was interested to see if there were any colleagues who had similar experiences with post-traumatic stress syndromes, so I started looking. I certainly found them. Gabby Arthur, a colleague and war veteran, also treats patients with post-traumatic stress disorders with several homeopathic remedies. I link you to her treatment examples below the video. Another colleague who caught my attention is Torako, who also treats post-traumatic stress syndromes with several homeopathic remedies and spoke about it at the Children's Homeopathy Congress in 2010. I also link you to the seminar recording below the video. Second question is, was your daughter healthy before the vaccination, or was there something else going on before? Some of these remedies aren't comprehensible or they are mutually antidotating. I would give her camphora C30 to clear things up and then restart with carcinosinum or medorinum, depending on what happens, and then see what happens. The most noise-sensitive remedy is probably borax, and I'm not entirely sure about other remedies when prescribing them. And why are you having her wisdom teeth removed after such a vaccine injury? First of all, it's a worry you didn't watch all the parts of the seminar. It's worth catching up. My daughter isn't vaccinated against COVID. Besides vaccination, there are other causes of ME/CFS, such as infection with various pathogens, usually viruses, or a head injury. I always treated my daughter's head injury with homeopathy, and they are supposed healed. However, neither arnica nor natrium sulfuricum worked very well at the time, and unfortunately I wasn't aware that Helleborus could be useful in such cases. In one of the videos I mentioned that I found something on this topic in Kent. I would like to correct this at this point because it was fatak. I quote from Helleborus Niger. For concussion caused by a blow to the head, if arnica hasn't helped. End of quote. Regarding the choice of medication, I always treat a symptom complex. For example, in the case of shock, I repertorize all the symptoms present during the shock event and then prescribe a homeopathic remedy. For example, we see the categories of emotional complaints caused by psychological shock, attempts to escape, fear due to a previous shock, and emotional symptoms caused by injuries or accidents. I work through each symptom complex in this way. In the case of opium, for example, these included all complaints related to drowsiness. When choosing homeopathic remedies, the modalities and overall picture of the remedy should always match the patient's picture. Therefore, I have not yet had any negative experiences with an antidote. As mentioned before, I tried 9 months of classical homeopathic treatment, including the approach of clarifying the case in order to then get a picture that pointed me to a single remedy, unfortunately without success. Unfortunately, the wisdom teeth were causing problems, so our daughter had no choice but to undergo surgery. The medications required for this did indeed pose a problem. More on this in another video. I hope I have shed some light on these questions, as these cases are not easy even in homeopathic practice. Now let's move on to the next item on the agenda: broken bridge syndrome, which is derived from new research. In April 2025, a preprint publication on this topic was published, entitled Brain Stem Reduction and Deformation in the Cerebellar Peduncles of the fourth ventricle in long COVID patients. Insights into neuroinflammatory consequences and the broken bridge syndrome. I link you to the publication and a German summary below the video. The Hamburg scientist Dr. Ziaya discovered that in post-COVID syndrome, a decoupling occurs between the brainstem and cerebellum, specifically in the area of the cerebellar pedunculi. The brainstem, which includes the pons, medulla and midbrain, controls autonomic functions, for example, functions that we cannot control with our will. The cerebellum is responsible for motor skills, cognition, perception and recognition, and the regulation of the emotions. The cerebellar pedunculi are the data highways between the brainstem and cerebellum. Information about movement, balance, body awareness, circulation, breathing, and much more flows through this area. If there is a disruption in this area, the information no longer reaches the target area effectively. Stimuli can no longer be adequately processed, and coordination disorders and disturbance in deep sensitivity can occur. ME/CFS is a disease that can also cause circulatory disorders in the brain. For this reason, we will briefly examine the mechanism of our body uses to regulate blood vessels. First, the sympathetic nervous system plays a very important role. Second, there are regulatory hormones such as adrenaline, angiotensin II, and vasopressin. And finally, local regulatory mechanisms such as vascular muscles, factors in the vascular lining, and tissue metabolites. We will take a closer look at two of these local regulatory mechanisms, the Baylis effect and the Euler-Liljestrand mechanism. One regulatory mechanism of the vascular muscles is the Euler-Liljestrand mechanism. This mechanism causes the pulmonary arteries to constrict when the body is undersupplied with oxygen. The exact biochemical process of the Euler-Liljestrand mechanism are not yet known. It is assumed that in an oxygen deficiency inhibits the mechanosensitive potassium channels of the arteriovascular muscles cells of the lungs, causing the calcium concentration in the cell to rise and the vascular muscle cells to contract. In the case of lung disease, this mechanism reduces blood flow to poorly ventilated sections of the lungs and improves blood flow to better ventilated sections, allowing the lungs to absorb more oxygen. ME/CFS patients can also experience breathing problems, leading to this redistribution of blood. In the case of lung diseases, lying on one side often leads to better oxygen exchange in the healthy parts of the lung, which is why we often find improvement in homeopathic anamnesis when lying on the right or left side. Another regulatory mechanism of vascular muscle is the Baylis effect, which ensures constant blood flow to organs. Arteries and arterioles subject to this effect have mechanosensitive cation channels in their inner vessel walls. When the cation channels open, calcium ions flows into the muscle cells of the vessels and cause them to contract. In this way, optimal blood flow to the kidneys, gastrointestinal tract, and brain is regulated almost autonomously. The homeopathic remedy opium, which we have already discussed, can positively influence the Baylis effect if it is reduced, as it affects vascular smooth muscle cells. Nicotine, which acts on the nicotinic receptors, also constricts the blood vessels and thus leads to poorer blood flow. This occurs, among other things, through the release of the neurotransmitter adrenaline, which ultimately constricts the vessels. And this brings us to the actual topic of nicotinic receptors. In some of my videos, I have already discussed nicotinic receptors, such as the homeopathic remedy Petalea trifoliata or the homeopathic remedy curare. Today, I'd like to discuss in more detail what these receptors mean in relation to ME/CFS. Nicotine receptors are located in the cell walls of nerve and muscle cells and bind the neurotransmitter acetylcholine, as well as nicotine or similar substances. As a result, an exchange of potassium and sodium ions can occur. Myasthenia gravis is a disease in which autoimmune processes destroy precisely these receptors, thus disrupting the transmission of nerve signals to muscles. There are other homeopathic remedies that can exert their effects on these receptors. Here we have the homeopathic remedy made from crate saliva, known as Bungarus, but also Tabakum. A research team from Leipzig hypothesizes that the coronavirus with its spike protein permanently binds to acetylcholine receptors, thus blocking the body's own substances. Nicotine patches are intended to help displace the spike proteins from the occupied receptors, thus freeing them up for the body's own substances. 73.5% of study participants reported symptom improvement with nicotine patches. Regarding nicotinic receptors, we have already discussed Petalea and curare in detail. We will now take a closer look at Bungarus and Tabakum, which also act on these receptors. Like many other snake remedies, Bungarus cannot tolerate tight clothing. Jaundice may be present or have been a problem in the past. Patients crave recognition, do not want to be alone, are easily hurt and tend to brood. They love to travel and are sensitive to criticism. Small things provocate and anger the patient. Injustice is not tolerated, and patients do not want to talk to anyone, cannot tolerate noise, and only want to sit quietly. Forgetfulness is another issue. Memory becomes weak, and there is an indecision, lack of concentration, confusion, and mood swings. Emotions cannot be controlled or must be controlled by the mind. Patients become snappy, react irritably to questions, cannot control their hand, and hit others. There is a fear of stage performance. Small things irritate or make them cry. Nevertheless, patients are hopeful, talkative, and positive. Bungarus patients are perfectionists, have nighttime fears when they are alone, or fear that they cannot be cured or are sick. Feelings of abandonment or remorse may arise, but shamelessness can also be an issue. Hunger is intolerable and increased, so that something must be eaten constantly. Patients crave ice cream, cheese, butter, and tea. There is a desire to eat cold foods. They also thirst for large quantities. Back and neck pain are common. Neck pain is often associated with debilitating headaches. The pain extends upwards into the head. Heat in the head and headaches may be present. The legs are heavy and the hands and legs feel paralyzed. The palms are cold and there is a feeling of heat in the thighs. There is drowsiness. Waking and moving are difficult. The patient controls sleep because of fear of falling asleep. Dream of shame, guilt, accidents, anger, fear, death, embarrassment, and being exposed are present in the drug picture of Bungarus. The mouth and lips are dry. Loss of sensation and smell may occur, and sensitivity to light may be present. General weakness also characterizes the drug picture of Bungarus. Pain may be accompanied by vomiting. Stool may be hard and there may be stiffness. Bungarus is relieved by firm pressure after eating, lying still, or sitting. An aversion to warm food is present and hunger is exacerbated. Dr. Farrokh Master has studied snake remedies in depth and has even published a book on the subject. I've included a link to Dr. Master's detailed test report on Bungarus faciatus below the video. The drug picture of Tabakum includes forgetfulness and slow perception. Patients may be unconscious or experience faintness. Dizziness is usually accompanied by a feeling of heaviness in the head. The stomach is weak, which is why complaints such as nausea and vomiting occurs. Headaches are also accompanied by nausea and vomiting and are caused by fatigue or excitement. If these complaints are present, the abdomen must be uncovered. The face is pale. The symptoms are aggravated by noise or light. Heat and burning sensations occur in the eyes. Retinal images are retained and strabismus may occur due to the cerebral disturbance. Black spots may also appear in the field of vision. The retina may atrophy, which can cause blindness. Patients are covered in cold sweat. The lower legs and hands are ice cold while the rest of the body is warm. Pain in the facial bones or neuralgia may occur. Speech may be sluggish and therefore unintelligible. Appetite may be completely lost. The symptoms worsen with the slightest physical movement. In tobacco, sudden cerebral hyperemia can occur. All sphincter muscles can be paralyzed. Patients become drowsy when reading and studying. Breathing is constricted and attacks of suffocation can occur. We have symptoms that remain after a long, serious illness. Muscles contract spasmodically. Feet and hands feel so weak that tremors may be present. The head may feel as if someone had hit it with a hammer. Patients experience extreme exhaustion, severe pain, numbness, and muscle relaxation. The head is immobile and pulled backward due to neck stiffness. The back muscles are also affected by the stiffness, and in Tabakum we are dealing with spastic paralysis. Patients suffer from insomnia and a numb sleep. The ears feel closed. Tabakum is a medicine for illnesses caused by brain irritation, accompanied by stomach upset. The nervous system, especially the vagus nerve, is irritated and the entire muscular system is exhausted. The skin may become severely itchy. In my experience, homeopathic medicines that act on nicotinic receptors only make sense for patients who do not exhibit symptoms of numbness of the sensory organs. Taking such homeopathic medicines can lead to enhanced perception and thus to extreme overload and subsequent crash.